We have a representative from Pfizer, Dr. Isaac Kamau, who is a field medical manager and senior medical science liaison. I want him to come here and tell us just a little about Pfizer and stimulate our conversation on vaccines and immunizations. Dr. Isaac was my medical intern a long time ago, but not very long time ago. It was a good one, but he went later, he worked at the Aga Khan hospital, and then moved on to Pfizer. And we want to hear what he has to tell us in a short while. Isaac.
Thank you, Dr. Kigundu, and thank you everyone for this opportunity. My name is Dr. Isaac Kamau, as has been mentioned, and I am a field medical manager and senior medical science liaison with Pfizer Accord. And I'd like to take this opportunity to introduce what the Accord initiative is, and also introduce just basically explain what it is we aim to do. Yeah. So what we want together with you is help us work together to bridge the health equity gap for everyone, everywhere. That's the aim of the Pfizer Accord. So this is just a disclaimer for some of the products that I'll mention. This is for purely informational purposes, not medical guidance. So the Accord is an access initiative through which Pfizer is committed to providing the full portfolio of medicines and vaccines for which it has rights to 45 eligible countries. And the aim for this is to help bridge the health equity gap. And the products are provided on a not-for-profit basis to these countries. So 40% of these medications and vaccines are part of the World Health Organization list of essential medicines and includes some breakthrough prevention and treatment options. So these 45 countries were chosen according to their status, economic status as per the World Bank, when Accord was set out in 2022, and includes 18 lower middle income countries as well, of which Kenya is a part. So in terms of the Accord portfolio, it includes innovative breakthrough therapies and vaccines, and varies across 20 different medical therapeutic areas, from cardiovascular to obstetrics and gynecology and oncology. What we want to do is help support long-term sustainable access. And to achieve this, we aim at three things with the help of the governments who actually take up the Accord. So we are pursuing more efficient regulatory pathways for them, working with the country governments and their national regulatory authorities and in other international organizations. And then we also help strengthen supply chain and logistic capabilities by identifying where the gaps are and what solutions can be made available. And for the health workers, we aim to optimize the health workforce, and we offer support to ministries of health, local medical associations, and scientific organizations to collaborate on trainings and educational platforms. So just a snippet of what our obstetrics and gynecology portfolio includes. We have dinoproston for induction of labor and cervical ripening. We have norelhistrone, an oral contraceptive, as well as gestadone, which is also another oral contraceptive. We have estradiol for your postmenopausal vaginal atrophy, oxytocin for induction of labor and management of postpartum hemorrhaging, as well as agometrine. So these are just some of the products that are available specifically to the obstetric and gynecological portfolio. But in terms of your gynecological cancers, we do have an extensive oncology portfolio as well. But I won't focus on that now. I'd like to introduce the anti-infectives, as this will relate to part of what we are supposed to talk about today, which is the RSV, maternal RSV vaccination. So for the anti-infective portfolio, we have ceftazidime-avibactam for the treatment of your complicated UTIs and pyelonephritis and complicated intra-abdominal infections as well. We have meropenem, which I'm sure you're very familiar with, for treatment of your UTIs and gynecological infections. We have piperacillin tazobactam combination, which is for your broad-spectrum antibiotic for severe infections, including your UTIs, gynecological infections, and including postpartum endometritis and PID. Other products within the antibacterial portfolio include clindamycin, azithromycin, saltamicillin, linezolid, and tigecycline. We also have antifungals for invasive candidiasis. We have Anidulafungin. And finally, we do have several vaccines, most famous of which, of course, is the COVID vaccine. But we also have maternal RSV vaccination. And the maternal RSV vaccine is to protect infants against serious consequences of RSV from birth through 6 months of life. Why we feel this is important is because RSV is a leading cause of lower respiratory tract infections, related hospitalizations for infants. And infants are most vulnerable in the first 6 months of life. We also have another adult RSV vaccine for your older patients above 60 years who are at risk. Current standard of care is passive, so this will be the first active protection we have for RSV infections. And in terms of the product, in terms of the information for it, it's basically given as a single dose of 0.5 ml during the third trimester. So it's supposed to be administered towards your last clinic days, your maternal clinic days. And that is all I have for the RSV vaccine. And thank you for your time. And this is just a snippet of what the ACORD portfolio has to offer. If you'd like more information, it is available, and I am around. And thank you for your time.